Hi, we're here today with Dr. George Tiliatos in Las Vegas for the Mr. Olympia, and we're here to talk about why should you get your testosterone levels checked and how do you go about checking them. Hi George, thanks again for coming on.
Good to see you, Michael.
Good to see you too. So why should someone check their testosterone levels? What age should they check them even? Should you look at if you have symptoms, or should you do this as a general screening?
Both of them. When people come to my office and men and they complain of the symptoms and do they have labs, sometimes I'm asking, are you doing these labs randomly or because of a certain symptom?
Right.
So it could be both the answer, but you know, it's so sad that many men, I could say over 50%, they are not aware that having low testosterone. They've been complaining, of course, the fatigue, the foggy mind, the moodiness, the lack of sex drive, the lack of sex esteem, the erectile dysfunction, the tiredness, okay? And they are not aware of the hormonal levels and the andropause, of course.
Right.
And it's so frustrating because they find solution in other ways, in SSRIs, in the phosphodiesterase inhibitors, okay, perhaps in stimulants, and they don't understand that everything comes from the decline of the hormones. Cortisol goes up and testosterone goes down, and also growth hormone goes down. So I'm telling them that they should check out the testosterone, and one of their fears is, what if I stop it? And I'm telling them, why you should stop it? Something that will help you. Are you going to stop it? So it's like brushing your teeth.
Yeah.
You know?
You're going to stop brushing your teeth.
There's no reason to stop something that is beneficial for you, and actually you're going downhill. That's why we age. So many people say, oh, I have just above the lowest range, but I'm within range. Yes, but if you're 30, in your late 30s and your testosterone resembles of your 70s, it's so pathetic, and not just about how you feel, but this will lead you to other pathways, which is linked to diseases, all right, with diabetes and metabolic syndrome and anemia and osteoporosis and obesity, and this is not cool, of course.
That's a good point, but you also find some GPs will tell patients, oh, why were you on testosterone? Your levels were within this very narrow
those
range.
levels reflect to an age which is double of yours, and actually those levels are not linked
to
health
yeah.
and well-being, you know, and quality of living.
So I think that's an important thing to discuss with everyone. Is so often other clinicians who aren't aware. Even some of the endocrinologists are fixated on reference ranges, which one keep getting lower over the years for testosterone.
Well, something more than numbers, and actually it's so sad. The endocrinologic society and the urologic society avoiding the benefits of testosterone. They have demonized and perhaps it's referred to it's related to the toxic masculinity, but the lack of knowledge in regards to the benefits of testosterone.
And they're always overemphasizing the negatives.
They believe that you're taking in order to be jacked or big, or perhaps have sex all the day, but it's more than that.
They assume that very few people need it. There's a very small percentage of people that need it. But if you've got symptoms, then symptoms that are linked to it, along with biomarkers that are
100% of the obese men over 40 or over 50 are of low testosterone. Of the depressed, yeah. Of the depressed men also. You know, of the insulin-resistant men also. Oh. And 100% of those who died of COVID were of low testosterone. There's something pointed out. Somebody said, "Don't take this for granted." Yes, it's for granted. COVID kills you and also kills your fertility.
Yeah, and also has long-term effects like
long COVID. It kills your testicles, COVID.
Yeah. But that's transient, or that's...
Yeah, all right, but I mean, a man of low testosterone is ill, okay?
Yeah. And everything else spirals out of control when your testosterone's low. And
so you should check it at least once a year, annually, all right?
When's the best time to check it? I mean,
in the first thing in the morning, in order to, let's say, to be
11,
the highest levels.
Yeah,
yes, don't have sex the previous day, and don't overtrain in the gym, and also don't stay insomniac, all right?
So basically get enough sleep the night before your blood tests. Otherwise,
you should sleep.
If you get too little sleep, you're going
to... cortisol elevates, prolactin elevates, antagonizes, all right?
And you have an artificially low level, so you want to make sure you get a level that's more representative of how you are
Don't drink
normally.
alcohol the day before also?
Okay. So, I mean, those are some of the reasons why you should get your testosterone levels checked. There can be...
It's so sad because I'm asking boys and men to check out their testosterone and say, well, why are you checking? I mean, the endocrinologist asks, why are you checking? Why? I mean, do you have any kind of disease and things like that? I mean, since I pay my taxes and my dues to the state, why should I not check out my testosterone? What's the big deal about this?
Yeah.
So there's this fear and this hormonophobia and this demonization, this skepticism about this negativity about just checking testosterone levels.
Yeah, when I was first diagnosed, I mean, I had many doctors. My family practice doctor didn't want to even look at my testosterone levels, even though I asked him just check my level. He wouldn't check it. I ended up going to 3 or 4 other doctors.
It's a taboo subject, you know.
Yeah, well, this was back in 95, when I was first looking and thinking I've had a problem with my testosterone.
And it's so sad also that just prescribe Nevido or Avid, and they have no idea about other protocols. And perhaps, I'm not, because I'm suspicious, do they get any profit or benefit by prescribing this Nevido or Avid? I mean, I don't know. I mean,
well, I don't know, the whole pharmaceutical
it's
industry.
much more expensive, of course, than the normal, the testosterone theta, right?
Right. Well, for whatever reason, maybe it's just out of ease, maybe it's the big university hospitals and clinical centres. This is just easier for them to administer because they feel they've got more control by having the patient come in and doing the injection. So, I mean, obviously, you get your levels checked, and if you have a deficiency and you have symptoms, then you go to the next step,
and
is
sadly,
being diagnosed for treatment.
Other doctors, they put you on testosterone for a brief period of time only, let's say to increase your levels, but it's not your levels, it's the exogenous levels.
They take you off of it.
and then they stop it, and it's disaster because you simply have shut off. And also, the reason you start testosterone means you don't produce anymore. So they don't understand the basic homeostasis, you know.
How often have you seen that? Have you seen it quite a bit?
A couple of times,
yeah.
yes, couple of times.
I've
So
seen
they start administrating, and I'm saying that now the discussion is over. Why do you stop taking testosterone?
Yeah, I know some of the guidelines talk about trial of testosterone if you need it, but and then just going a little bit off point is for some men who start treatment and don't get better, or in their minds they don't get better. Why do you think this is?
They don't get better because it's a multifactorial. It's the free testosterone, it's the HCG, it's the prolactin, it's the estradiol. Okay, doesn't mean because you administer testosterone everything is going to be optimized.
Okay.
Every case is different, okay? So you need to see the whole blood work.
And how often should people be monitored then? Yearly? Twice a year?
When they are TRT?
Before TRT?
Before, at least once annually.
Yeah.
I would say twice a year, along with the PSA over 40.
Okay. And do you recommend, I think we recommend at the clinic, having a venipuncture test rather than a finger prick test. Do you agree?
Say that
So
again?
instead of using a capillary test, we recommend a venipuncture test.
Yeah, absolutely, yeah. It's more accurate.
One of the things that we've noticed is when you do the test, make sure you're not using biotin supplements. And there are so many supplements that have biotin in it, because you know the reason why. It skews the analyzer for when they're reading it. So what will happen is you might have symptoms of low T, or you might not even be aware, and the analyzer, being skewed by the biotin, will give you a higher reading of testosterone than you actually have. And so you think, well, it must not be my testosterone then, because the reading from the lab says it's normal. So that's a really, really important thing. And this was quoted by the FDA. A lot of people don't realize this, that some of these labs are very sensitive to biotin. So look at your supplements. How long do you say to stop the biotin or the supplements before the test? A week or 2 weeks?
Yeah, thanks.
So, okay, so anyway, that's...
You should stop taking multivitamin, though.
You should stop taking it before
because
the test.
Because biotin is included in multivitamins.
Of course. So the multivitamin also can have biotin in it, which will skew the analyzers. So don't worry about your hair and your nails for a few weeks. Best to take time out and then get a proper blood test so you know where you are. Make sure you get it done in the morning. Some of the guidelines talk about before 10 or 11, early in the morning you should be higher. And the other factor was there have been papers questioning why for men over 40 is it important to get it, because the diurnal rhythm is all changed after the age of 40.
The what?
The normal flow of testosterone, the diurnal rhythm for testosterone being higher in the morning and lower in the evening isn't always the case in some men over the age of 40. Have you heard this? You've seen? There's been a couple of studies that have pointed to this.
Yeah, we have to realize, we have to take under consideration that the lowest ranges go really low, below 200, and this is because it reflects to the average society levels.
Yeah, but that doesn't
to
mean
the randomized tests. So back in our grandfathers, the lowest testosterone was 450, and now it's 193, let's say, which is crazy to reach those pathetic female levels.
Yeah, exactly. But yet the doctors and
it's the feminism of the men.
Yeah, but that doesn't mean that's a healthy optimal level.
No,
and I think that's.
I mean, if you have 200 and the lowest range of the lab is 193, it means you're healthy. Come on.
Yeah, because you're.
Come on.
It's so ridiculous, and this is a fight that we have to fight all the time. Because what happens both in the UK and Europe, and I think in the United States as well, you've got practitioners who are very clued up about TRT and where optimal testosterone ranges should be. But then
some of them will say, "Come in 6 months again and retry your levels."
Yeah, but
what am I going to do in 6 months? I'm going to jump from the window.
Yeah. Oh, yeah. To keep waiting. But what I was going to say is,
wait for what? Santa Claus.
But the problem is some of the GPs don't recognize what an optimal level is, and therefore send patients home and say, "You're fine. Don't worry about it." And like you said, go back in 6 months. So again, these are things you should be aware of and
sometimes it's worse when you have 400 of testosterone
and you're right in the ball.
And your SHBG is 100 and your free testosterone is totally tanked, which also equals hypogonadism.
Yeah.
And you cannot save it with mesterolone or DHT, you know?
Exactly. So
those two prohormones or derivatives of testosterone does not substitute testosterone.
No, and I think it's a very short term to use the mesterolone. It'll give you a short depression of the SHBG.
It would be better to administer mesterolone along with testosterone rather than as a monotherapy of mesterolone.
To keep the SHBG low, so you get the best of both. And I guess that finally leads us to the question that if you do go on testosterone, you know, that some men will look at it as if they're no longer real men, and they're fearful that they're now being artificially.
So what? What's the point? I mean, if you're schizophrenic, you take medication. If you're hypertensive, you take medication. If you're diabetic, you take your insulin. If you're hypothyroid, you take it. What's the big deal about it? Testosterone is going to make you a young man. Okay, it's going to turn you into a healthy.
Exactly.
Because you are enhanced, so what?
I mean, look, if you're not making enough, and we know there are many reasons for it, then sometimes the best options are to stay the course.
Would you like to age and become miserable and fragile and go downhill and decline?
Because we know that's the end result if you continue with low levels, and we know your mortality increases with low levels. We know that Dr. Morgenthaler, Abraham Morgenthaler, talks about your lower levels of testosterone levels are equated to more malignant forms of prostate cancer.
Yes.
So there's so many
cardiovascular disease also.
Yeah. So, and obviously when people first start treatment, then they would go to a clinic that's going to be able to kind of manage and support them. So I think that's it for, why should you get your testosterone levels checked. We discussed when to get them checked. We discussed.
And also if you have insulin resistance, you check out. If your
HbA1c.
If your A1C is close to 6%, you should monitor your testosterone if you are hypogonadic, because taking testosterone will improve your prediabetes.
So check
also can reverse it.
So check your HbA1c.
Crystal said in the near future, diabetic 2 patients will have to assess the HPDA in order to receive testosterone medication that will cure the diabetes.
Or at least minimize it, and they might not require insulin if it goes that way. But in the meantime, there's also
that's why I'm saying testosterone is more than getting big or getting horny. It's about metabolic issues.
Yeah.
I'm going to explain this tomorrow.
Yeah, absolutely. So, and I'll be talking about the stigma around testosterone and the treatment, so it should be good. So watch this space. We'll have more videos like this, and also videos from Las Vegas at the Mr. Olympia education. And if you have questions, or if you've been told by your doctor that your levels are normal when you know they're not, or they look like those of a 70-year-old, let us know in the comments what your experiences have been, because we have nearly every day at the clinic, and we'll be happy to hear about it on the YouTube channel. And don't forget to like and subscribe. See you next time. Thanks, George.